A new report in the medical journal The Lancet says there is a serious lack of gender-specific research and data when it comes to heart disease in women. Heart disease, as you may know, is the leading cause of death for women globally. The report recommends more education on early detection for healthcare providers and the patients, recruiting more women for cardiac studies, and prioritizing research on heart disease in women. CBS News senior medical correspondent, that's Dr. Tara Narula, met with a woman whose cardiac scare during pregnancy caught her by surprise.
Ooh. Just weeks before her baby was due, Yulia Nurakan knew something wasn't right.
I felt nauseous, I felt dizzy, and I felt like I was about to faint.
Concerned for the baby, Yulia rushed to a local hospital in Queens, New York, where her daughter Olivia was delivered via emergency C-section. Tests showed Yulia had suffered an aortic dissection, a potentially deadly tear in the lining of the aorta that affects blood flow to the body and can potentially rupture the entire aorta.
Obviously, if this happens, then the patient literally dies instantly.
Dr. Ismail El-Hamamsi is an aortic surgeon at Mount Sinai Hospital in Manhattan, where Yulia was taken for life-saving surgery, leaving her newborn baby behind.
Bye, baby girl.
After 6 days of only seeing Olivia on FaceTime calls, Yulia finally got to hold her.
What did it feel like to hold her in your arms?
It felt like she belonged there.
Say hi.
Had she not been pregnant, Yulia says she likely would have ignored her symptoms. And heart disease symptoms in women can differ from those in men. Rather than chest pain, women sometimes report indigestion, back pain, or shortness of breath. That's one reason the authors of a new report in The Lancet say it is critical to have more women-specific studies.
Women are not small men. We need to think about women as their own individual biology and come up with the answers for them.
Explain to us how the current system is failing us when it comes to research and women.
We keep saying that we're understudying, under-recognizing, under-diagnosing these women, and we need to make all kinds of efforts to make sure that our clinical trials have good representation of women. So when we have new devices, new drugs, the application is not just for men.
For CBS This Morning, Dr. Tara Narula, New York.